Democratic vice presidential candidate Tim Walz has an extensive track record on healthcare policy, but his personal connection to reproductive freedom as an IVF dad might be the most salient factor in this election. What has Walz accomplished in healthcare as a congressman and governor? And what impact might he have as vice president? This episode of CareTalk is brought to you by BetterHelp. If you've been thinking about starting therapy, there's never been a better time to give it a try. BetterHelp offers online therapy that's accessible, flexible, and tailored to your needs. Whether you're dealing with stress, anxiety, or just looking for personal growth, BetterHelp connects you with licensed therapists who can support you on your journey to becoming your best self. Never skip therapy day with BetterHelp. Visit betterhelp.com/caretalk to get 10% off your first month and take the first step toward improving your mental well-being. That's BetterHelp, HELP.com/caretalk. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, senior advisor at Walgreens.
Come join the fast-growing and vibrant CareTalk community on LinkedIn, where you can dig deep into healthcare business and policy topics, access CareTalk content, and interact with the hosts and our guests. And please be sure to leave us a rating on Spotify or Apple while you're at it.
We love those ratings, David.
We sure do.
So David, I think that Tim Walz has the most complete record as a leader on healthcare policy and reform of any politician of modern memory. He's not a single-threaded issue candidate. This guy, governor and congressman, has probably the most successful track record at reforming healthcare that I've actually seen in modern politics.
You know, sometimes, John, especially when they're trying to put up a new justice for the Supreme Court, you want somebody who's like a complete blank slate, has nothing to look at. But of course, a governor, compared with the backgrounds of the other candidates for president and vice president, actually has a lot more, that he can talk about. And Governor Walz, in particular, has done a lot in healthcare, including also when he was a congressman. And there's a lot of stuff to tick off, and I think it goes more or less as a mainstream but progressive playbook. But John, I think actually that where the vice presidential candidate fits in here is really amplifying this reproductive freedom argument, and in particular as it relates to IVF.
I think that's true, David. But again, what impresses me about Tim Walz, when you say who is Tim Walz at a time when America is trying to figure out who this guy is, he's a leader who has passed common sense healthcare reform bills as a congressman and a governor that have delivered real value, whether it's around affordability, around prescription drugs, or access to healthcare services. But let's start with reproductive freedom and where he stands as opposed to the alternative. Who is Tim Walz, this person who's actually articulated himself as a warrior for reproductive freedom? Can you maybe tell our viewers a little bit about where he stands and what successes he's already kind of notched already?
Yeah, well, I mean, the number one success is that he's a father due to in vitro fertilization. And sometimes when you hear someone talk about reproductive freedom, it could be framed as, well, that's just a euphemism for, being pro-abortion or something like that. But reproductive freedom is broader. And IVF is something that people can really identify with, and also makes it more of a man's issue, too, not just a woman. And so...
do you want to, maybe I'm just laughing because I remember when Trump came out on stage during the RNC convention, they were playing It's a Man's World in the background. But maybe talk a little bit about what IVF is and what the issue is, because it's been kind of confused in modern parlance.
Well, so here's the thing, John. So in vitro fertilization means that the fertilization takes place in vitro, meaning in glass, meaning in the test tube, meaning in the lab, as opposed to in the body. And so once the embryo is created sort of offline or in vitro, and then it's implanted and carried to term as a pregnancy. Now, what happens is if you look at some of the arguments about banning abortion, you actually get very quickly into seeing where IVF is threatened. And in particular, if life begins at fertilization, that is, when an embryo is a person, because that's what the fetal personhood movement is about, then IVF suddenly becomes a problem. Because in order to do in vitro fertilization, you typically need to create more fertilized eggs, more embryos than there are going to be ones that are implanted. And that's just the nature of how IVF works. And so when you, as IVF is done here, you're going to have the issue of if these are all actually people, then that's a problem. You can't actually create embryos. So Republicans have rushed to say that actually, well, no, they're in favor of IVF. Don't get me wrong. Just because the Alabama Supreme Court took certain steps to make it look like you couldn't do it. No, Republicans are in favor of IVF, but actually, logically, they're not, and not everybody actually is.
No, in fact, if you actually follow the logic of the Republican position around protecting and sort of not messing with the typical biological production, it's sort of unclear what the Republican position is. It's actually there are many advocates on the right in the Republican Party who are very comfortable with banning IVF. But just to be clear, it's 2% of all births in the U.S. 8 million people in the United States were 8 million babies are the happy result of in vitro fertilization. So the threats to reproductive freedom, which include in vitro fertilization, which is a common and in fact a necessary path for some people to have healthy children, the access to contraception. The Republican agenda is pretty aggressive. They're not even stopping at the line of restricting access to contraception. I mean, they've been every time they hit one of these mainstream reproductive freedom issues, like access to safe in vitro fertilization or access to contraception, they sort of go all wobbly. But I actually think the reason why it's even an issue is because they've made it an issue. And I think, again, Tim Walz can personally talk about IVF, but his positions on reproductive freedom are even clearer. As governor, I believe he enshrined access to to abortion in the state of Minnesota.
That's
he
right.
has been a consistent advocate for fair and complete access for women to have to sort of control their own bodies. Again, but his track record on health, on the freedom to access healthcare is even broader than that. I mean, he feels he has articulated, as has Kamala Harris, that healthcare should be a right, not a privilege based on income. Maybe we should delve a little bit into what he's been able to do there. Do you want to talk a little bit about what he's been doing in terms of healthcare reform in the state of Minnesota?
So one of the things that Minnesota has done is embraced the Affordable Care Act as opposed to sort of, pushing back on it. So they have the Medicaid expansion, they have a marketplace that they run, and the results speak for themselves in terms of being able to get to a low rate of uninsured, 3.8% of people in Minnesota uninsured versus more than double that nationally. He's also supported certain aspects of the Affordable Care Act and related laws that haven't always made it at the federal level. So there's support for a so-called public option, which would compete with private insurers. And that's actually moving forward, and it's supposed to be instituted in a couple of years. There's been a lot of pushback from providers about that because they worry it's going to pay them lower rates. But that, of course, ties into affordability. So he's done a lot in that area. And that's probably the biggest one in terms of actually the overall access.
But I mean, he also has a long track record of being in favor of capping and limiting the cost of prescription drugs. One of the interesting things that I think that the state of Minnesota does now, and I think it's a law that was passed while he was governor, they actually require like the top, I think it's 70 or 100 drugs that have the largest cost increases to be published and then for them to the drug makers to justify why they're gouging consumers. The state of Minnesota had a landmark settlement with two of the large insulin makers, which has effectively capped the cost of insulin for when there's actually two pieces, capped the cost of insulin as part of the settlement for all Minnesotans, but also provided access at a very low cost for 90-day emergency access to insulin, because there was a 26-year-old man who died because he was rationing his insulin. If you look at, Tim Walz is a true healthcare warrior around healthcare reform. He's notched wins in terms of reproductive freedom, safe access to consistent healthcare. What that means, by the way, is that people don't crash into the emergency room because they've got coverage through the Affordable Care Act. He's capped drug prices, or actually capped drug prices for insulin, and has, I think, started this question of whether the shame and blame around price gouging can shame drug companies into actually fairer pricing. Maybe we should also talk a little bit about his experience as a veteran and what he's been working on in terms of veterans' mental health.
For sure, John. Let me say one more word on the drug pricing first, which is that I think this is actually consistent with the overall sort of more joyful and positive approach and looking favorably on people. So you say, look, someone should be able to get insulin. It's a right to have healthcare. It's not the attitude that you see on the other side, which is more about, someone's going to try to come in and steal healthcare for free, and they don't deserve it and didn't take care of themselves, or they're an immigrant. So it's very much, I think, on that positive side. Yeah, somebody died because they couldn't get insulin. Made sure now you can go to the pharmacist and actually get insulin. This $35 a month payment for insulin is consistent with what's tried to be accomplished on the national side, but hasn't always been successful. On the mental health side, when he was in Congress, as you say, as a veteran, he was one of the sponsors of what they called the Clay Hunt Suicide Prevention for American Veterans Act, which was signed by President Obama in 2015. And that was focused very heavily on this issue of rampant level of suicide among veterans. This bipartisan issue, which I think is also consistent with Walz's approach overall. And then, as more recently as a governor, he signed an omnibus mental health bill in 2022 that also addressed this issue of access to prevention for suicide.
And I think what's remarkable, he's not just stopped there, David. He's actually worked in the state of Minnesota to support a significant increase in the number of mental health providers. He's actually looked at programs to provide loan forgiveness for mental health providers. He's dealing with the supply of providers, making sure access is fair and reimbursement is fair. He actually was with one of our other guests, Patrick Kennedy, at his mental health summit, because he doesn't, I think, due to the fact that in addition to focusing on suicide prevention, he's really tried to make Minnesota a place where everyone who's got a mental health challenge can get access by looking at not just the price, but actually the supply and access challenges that are related to the fact that historically mental health providers have been underpaid by insurance, and we actually haven't funded enough positions. He's a very that's why I'm saying this is again probably the most thoughtful, comprehensive healthcare reform candidate that I can imagine now that we've delved into his track record. He's even worked on, addressed, and successfully made some progress around issues of the medical debt that's been really burdening some of the poorest patients in America. Do you want to talk a little bit about what the successes he's notched as a governor in terms of medical debt reform in the state of Minnesota?
In Minnesota, they have something called the Minnesota Debt Fairness Act, and it specifically focuses on not allowing providers to withhold care from patients who have debt. Now, it's not a hypothetical measure. It happened that Allina Health, which is one of the providers there, was actually restricting care for patients that had certain levels of debt. So it made it a little easier to actually go against that. So that sparked this Debt Fairness Act, added various regulations for medical billing, and making it possible for providers to be successful, but at the same time not burden people that really couldn't couldn't handle it. So there's been more action there of things that have just been talked about at the national level. And John,
just to be clear, again, it's a comprehensive solution. In addition to not being able to deny care, it suggests that your medical debts can't be transferred to your spouse. Medical debt can't be kind of crash your credit rating. What you see with Tim Walz is a consistent approach to reform, a focus on the details, and frankly, a track record of success. I mean, the more we dug into it, David, the more I was impressed with not just the fact that he's got positions, but he's passed law and invested in a lot of reforms that are going to make Minnesota a safe place to get sick and a fair access to get healthy again. It's pretty remarkable.
John, healthcare is a big part of the economy, which means there's a lot of people who have a stake in it, and in some cases,
including us.
So it's instructive to look at what happened last year, where there was a big fight over a perennial issue that the nurses unions like to bring up, which is nurse staffing ratios. And so they were looking for basically mandating how many nurses you had to have per bed. And that is not popular among providers, especially because it drives up costs and it could reduce capacity if you have to close beds because you don't have enough nurses. And Minnesota is also a place that has some big provider organizations like the Mayo Clinic. It's also home to some of the biggest medical device companies like Medtronic and some of the biggest health insurers like United. So you've got a big healthcare economy that he has to deal with. And so this originally, the bill was called the Keeping Nurses at the Bedside Act. And it eventually changed to the Nurse and Patient Safety Act. And from the standpoint of the nurses, it was watered down. From the standpoint of others, it was made into a more workable kind of a bill. Mayo Clinic, which is got a big national brand and is the biggest private employer in Minnesota, bigger than Target or bigger than any of the other, private companies there or public companies, said, well, we may invest outside the state. So he's having to deal with that. And as a result, I think he got something workable that maybe nobody's completely happy with, but it actually occurred and is working.
Well, I think, again, it shows a willingness to compromise and work with the private sector to come up with the private nonprofit sector, in that case, to come up with a solution that worked for most, if not all. And that's probably the great advantage of having a governor with executive experience. Tim Walz has a great track record actually in Congress at being one of the leading bipartisan congressmen. I think he was rated like 7th overall among the nearly 300 legislators at really being a leader in bipartisan legislation. He represented a purple district, a district actually that was pretty red, pretty rural Republican before he was elected congressman. And as governor, in order to get things done, he's knitted together compromises under both, I think, a Republican House as well as a Democratic House in the state of Minnesota. But what's remarkable is these are solutions that make sense at the headline level and also, I think, are impressive in the details. One of the things that he has been a little bit skeptical about is for-profit Medicaid managed care. And, I'm not quite sure that that's necessarily fair given the track record of for-profit versus not-for-profit Medicaid managed care. But the long history of the Democratic Farm Labor Party, which is what the Democratic Party is called in Minnesota, has always been a bit skeptical about any for-profits. But maybe we could talk a little bit about how one of the other large employers in the country, as well as in Minnesota, United Health Plan, was kind of tweaked about that.
Yeah, well, it is interesting, John, that if you think about who are the big players, and United being the biggest one for-profit health plans, they really haven't been able to do that much business in Minnesota, which is their home state, because it is not a state that's friendly to nonprofits. It's kind of like Massachusetts in that respect.
What I meant was Minnesota. You mean?
That's right, Minnesota. That's correct. So I misspoke. But Massachusetts, where you've got a lot of nonprofits, we also don't have any big for-profit health insurers. In Minnesota, you do. And for a long while, they were not allowed to participate in Medicaid. And then they were allowed for a while. and now they're not being allowed again. So that's getting a fair amount of pushback. John, I don't know whether the sort of, for-profit versus not-for-profit designation is that meaningful when it comes to healthcare. These are businesses. Some are for-profit businesses, some are not-for-profit businesses. The main difference being about whether they pay taxes or not. There are some differences, and maybe not-for-profit is a little bit friendlier. I think the issue with Medicaid insurance plans in general is that while you've got some providers that might want to do something that's innovative, like more of a value-based approach, something that addresses things more broadly, the Medicaid HMOs are more likely to sort of squeeze them on unit reimbursement levels and not allow that type of innovation to occur. That's one of the arguments against it. And there's some populations within Medicaid that are particularly vulnerable, and I think there's concern about having them be subject to a Medicaid HMO.
Yeah, I just think you got to look at the track record of outcomes, and I think it's mixed on both for-profit and the non-for-profit side. And I would hope that the regulators would be open to looking at outcomes and not just getting stuck ideologically. But again, what impresses me about Tim Walz is he's clearly a progressive reformer on healthcare. But these are common sense issues. He's the healthcare leader who wants to make common sense solutions work for average Americans, whether it's access to reproductive services, health services, whether it's fair prices for drugs, and whether it's solving some of the bigger social challenges we've got, like suicide with ex-military folks, and suicide, mental health issues, access to mental health in general. I think it's going to be, he is I think we've discovered in our work, David, a lot of substance to this, to this person who's been a little bit of a question mark in the national stage, and has really gotten the most progress by pointing out the fact that the Republican Party's positions are kind of weird.
Yeah. They are, John. So let's end on one of those things that shows why he's bipartisan and practical. So I mentioned this, nurse staffing ratio bill as it started out. One of the things that ended up in the bill was a focus on protection against violence in the workplace, which is a nonpartisan issue that affects nurses in particular. And so that's where a lot of the emphasis was placed in the bill, and also providing benefits for nurses. And so that's one way that it actually worked out, and people could be happy about it at the end of the day and continue to endorse him, even if they didn't agree with everything that he was doing. Well, that's it for yet another episode of CareTalk. We've been talking about the new Democratic vice presidential candidate, Tim Walz, and his extensive track record in healthcare. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, senior advisor at Walgreens. If you like what you heard or you didn't, please subscribe on your favorite service and leave us a review.